Okay, today's February 26, 2013. We're here with Ann. Ann came to me all the way from Oregon because she's got a problem in her shoulder. She injured it many years ago, a fracture. It became frozen. They had to put her to sleep to get it to move, and she was able to move it. And then last year, it started to freeze up again. She said the doctor injected her with cortisone, and it did nothing, and it was very painful. And she's come to me with a frozen shoulder, and it was basically frozen, didn't move. I didn't video it beforehand because there just wasn't movement. And now I just did an ozone injection into the joint. Actually, I did two. Did the injection hurt? Did the injection hurt?
One did, one didn't.
Okay, is the one that did hurt, is it still hurting you? No, okay, and that was several minutes ago, right? So that's all gone, correct? Okay, let's see what you can do with your shoulder now. And can you get it above your head like this? Okay. That is a significant change than when you walked in the door, isn't it?
Yes.
Oh.
Yes, indeed.
Yes, indeed?
Yes, indeed.
Okay. May I video you as well?
Did it what?
You're on my movie.
Yes, I am.
Okay.
Yes.
So you're pleased with that, right?
Yes.
Okay. I'm going to take you through some things you'll need to do to keep that fluid to the best extent. Now, there is significant injury in your shoulder. There's a lot of degeneration. So we'll do what we can to mitigate that, but I'm glad that the prolozone was able to free it up. May I post this on YouTube?
Yes.
Thank you. And sir, may I post this on YouTube?
Yes, you may.
Thank you. And we just did your hip. Can you tell the viewer what you noticed after we did prolozone to your hip?
It doesn't hurt anymore, and I can move it better without any pain.
Without any pain. So there's 100% pain relief from the one shot. So we need to see how you're doing in a couple days, right?
Okay?
All right,
Fine.
thank you. And it's been 2 days since I did your hip. How's your hip doing?
My hip is doing fine. Very little pain.
Very little pain.
Almost none.
And I think you had a comment too, didn't you?
I had a comment that she went up 3 flights of stairs this morning and she hasn't walked upstairs in my house at home, just 1 flight, for 6 months. And now she's walking up 3 flights of stairs to get to our 3rd floor apartment.
And you had a comment about that? Didn't you say it's sort of unbelievable?
Well, it is unbelievable that it was so quick.
Thank you. Today's date is February 28th, right?
Yes.
So this is just 2 days after I did your hip, one shot. Thank you.
That's right.
And I may put this on YouTube?
That's fine.
May I put this on YouTube?
You certainly may.
Thank you. And I also wanted to get you 2 days after we did your shoulder. You can put your arm down now. That's significantly better than you walked in, but your shoulder is highly advanced and it's going to take a lot more work. It'll probably take physical therapy as well.